the nursing care in cpap. First, measure the head circumference in centimeter properly. Select the correct size bonnet, which is usually 1 to 2 cm less than the head circumference. Stretch the bonnet with your hands initially for ease of placement. Slip the bonnet onto the infant's head, completely covering the ears. With back edge of the bonnet at the base of the neck, the front edge of the bonnet should be just above or on the eyebrows. If bonnet becomes loose during prolonged usage, replace the bonnet. Better to avoid reuse. Use the sizing guide to choose the suitable prongs and mask. Mask should not touch the edge of the nose, septum or the eyes. Prongs should be snugly fitting the nails without stretching the skin. Otherwise, it will cause nasal injury or septal erosion. Use the biggest possible size. Use the correct length of nasal tubing. Use the shortest length possible. The clear tubing should not extend over the infant's forehead. Attach the prongs or nasal mask. Connect the prongs or mask to the nasal tubing, ensuring that it is inserted fully. If using prongs, use sides of the prongs firmly to expose grooves. Start from one end, insert the prong grooves into the nasal tubing. Attaching the flexi trunk. Nasal tubing should be parallel to the infant's face, not slanted upward or downwards. Attach the circuit to the nasal tubing according to the instructions by manufacturer. Set gas flow and FiO2. Check for gas flow by placing hand below the nasal prong. Finally, check the septum integrity according to the recommendations. There should not be plunging of the nose. Hook the clips from the side straps of the bonnet to the glides. Both straps at the same time for central position with the equal pressure. Fix the round velcro tabs to the blue straps of the bonnet. Use the least tension possible to maintain the prescribed cpap level and stability of the interface. Disconnect flexi trunk by gently twisting the connectors. Do not pull forcefully as this may damage the tubing. Take correct size bonnet, mask and prongs. While putting prongs should not touch the nose. There should be an air cushion between the nasal prongs and the nose. Foam block holders should be in the middle. If it is towards one side, there will be uneven pressure in the nasal septum, which can lead to nasal septum injury. You can use nasal prongs or mask alternatively every 4 to 6 hours so that nasal injury can be prevented. We should monitor for redness or nasal injury every 4 to 6 hours as per unit protocol. Half of the air will be going into the stomach. Proper vent should be there. OG tube of proper size, preferably number 8, should be inserted and make sure it is in the stomach. Keep the OG tube open. Monitor pain. Check foam block holder whether it is in midline. Make sure that the prongs are not pressing on the nails. Monitor nasal injury hourly. Monitor bubbling of air column. Monitor for heart rate, tachypnea, increased work of breathing, SpO2 and increase in FiO2 requirement. If FiO2 requirement more than 5%, note this and rule out pneumothorax. Do a transplantation and get chest X-ray.